Well, doctor, what was my condition like? If the hernia becomes like a sugary chickpea, the laser may not be effective. We use special methods to soften it by injecting solutions, making it softer than the sugary chickpea. After softening, the laser becomes more effective. The shoes are a problem. They hurt a lot. It is becoming effective now. The laser is becoming more effective successfully. Shoes are a real problem. They hurt a lot. It's a big problem. That mechanism definitely disrupts the elegant posture, the mathematics, the architecture of the spine. Because it compresses. Yes, it disrupts, meaning it applies an asymmetric force upwards. So of course you have to wear them, but there's no need to wear them unless absolutely necessary. As time goes on, technologies will continue to advance. Surgeries, in all specialties, not just in the field of neurosurgery, we used to perform huge surgeries. We would open the brain. I have a 33-hour surgery, just think about that. You open the brain, you enter the brain vessel. Surgery, and the vessel's inside the brain. Now we enter through the groin and perform a small procedure inside the brain. Of course, where has technology brought us? So we've started to forget a lot of surgeries. During the period when I first started my specialization, with the concepts we were using, for example, if you had a hernia 20 to 30 years ago, they would keep you bedridden, like a cripple for 6 months.
They put you in a cast?
There was a concept called body cast, for example. They put you in a full body cast as you have a hernia and you're bedridden like a cripple.
Bedridden for 3 months. Had hernia. Is there a thing, or have we run out of it? You see something like this. Old ones know.
We know this because we have read about it. We didn't do things like that either, but these were done in the past. Then we moved on to microsurgeries, very tiny ones. Now we have endoscopic approaches, minimally invasive surgeries. Can I explain the interventional methods now? So our hand is very strong, and we are getting stronger. That's why you don't worry at all. Perhaps in 5 years, they won't even diagnose hernias. Vaccines will come out. There will be a hernia angle. Structures that produce strong collagen lead to stronger people. So people were stronger back then. She was giving birth in the field. Can a woman give birth in the field?
She can't give birth. Why? Because
there's no strength. So time also changes the shape of a person. It changes its anatomy. It changes its structure. So we time.
The greatest master is time.
The greatest master is time.